Grid 7 here, and got this article here that says health experts still learning about Omicron subvariant. Apparently it's now dominant in the Northeast. Let's take a look at this article and see how it educates us about the subvariant, which I believe is going to be XBB. As a version of COVID-19's Omicron variant, the XBB.1.5 subvariant, there it is, grows more prevalent in some parts of the U.S., health experts say it likely escapes immune protection better than previous mutations. There's a shock. Though it's still unclear whether it causes more illness. Right there, they're already saying that. And this, they've already done everything they've said about right here. What more can they talk about? But apparently more than 80% of coronavirus cases in the Northeast are now due to XBB.1.5. According to health authorities, XBB.1.5 appears to be the most transmissible subvariant of Omicron that has been detected yet. Yes, I believe I saw somewhere it's 5 times more contagious, like any of these other ones. The bivalent COVID-19 vaccine and antiviral treatments like Paxlovid, and I'm not familiar with that one, are still believed to be effective at treating the strain, though they may not be as effective when compared to previous mutations. In fact, I think I just did an article video about this where it said the vaccine needs to be done with not only the vaccine, but also getting infected if you really want to be protected. That makes no sense to me. Continuing on, Bernard Keynes, medical director for infection prevention at the Mount Sinai Health Systems in New York, said the proportion of patients with illness severe enough to require an intensive care unit stay is the same as with previous variants. Right there, you're already kind of seeing it's not any more dangerous type thing. No, they were saying recent labor disputes actually causing more problems. The presentation is for the most part the same. Maybe they're not presenting us as ill, but we're still seeing plenty of ill patients, and we're still certainly seeing patients that die. Yes, that is unfortunate. I do not like that. I do think we could do better with real treatments instead of just pushing the vaccine. But this article will push the vaccine here coming up. Wu said that XBB.1.5 does not appear to be more lethal, which kind of contradicts, they were saying no. Unclear if it's whether severe or not. No. And noted that anytime more cases of COVID-19 are seen, morbidity and mortality will increase in turn. Yeah, there's just, if everything increases, just stupid that way. The reality is, people shouldn't be any more concerned about the new variants because they should be just as concerned about this variant as they were about the previous variant. They're all equally dangerous to a certain extent. Shreya Doran, Chief Infection Control Officer for Tufts Medicine in Boston, said the new dominant strain was not really such a big deal in her area. What they'll say a bit here later on. According to Doran, something like that. Her hospital has seen a modest increase in new admissions, probably because a lot more people are getting it because it's more contagious, though she noted that most of the patients who tested positive for coronavirus are not being admitted due to COVID-19 infection, but because of other ailments. I do feel like we're in a really good place. I want to make sure we don't lose access to testing, we don't lose access to treatment, that there is still work to be done when it comes to ensuring access to effective medications to treat COVID-19. Right there. What medications? I saw 2. I'm still waiting for the aisle in the food and drug area at the grocery store that says flu, cold, and COVID, where you can pick up the new Thera-COVID. You can buy for $10-15 if you think you feel it coming on. At the start of January, the Food and Drug Administration said it did not anticipate Evusheld, the preventative coronavirus monoclonal colonel, tongue-tied today, antibody treatment to be effective against XBB subvariants. The treatment was authorized for people who would not have developed strong enough immune responses from the COVID-19 vaccines. Joanne here, an infectious disease specialist at St. Vincent's Medical Center in Connecticut, said she doesn't think there's any reason to believe XBB.1.5 represents a change in the disease severity. Here we already seen, I think, several people saying that they don't see it, the change in disease severity and all that type of stuff. But remember up here they're unclear if it causes more severe illness or not. The folks that we're seeing are very ill with COVID are similar to the people that were very ill with COVID before. They're either frail, elderly, or they're people with underlying heart or lung disease. Again, no, repeated that. While severity does not seem to be worsening, which for some reason the media seems to want to happen. It's like they're salivating for it to become worse. It's like, oh, it became less. Darn it. No. She did new concerns with the medication. Recent studies, such as one conducted by the researchers at the University of Texas, found the bivalent COVID-19 booster had a reduced efficiency. I said, sorry, bit tongue-tied today. Against Omicron subvariants like the BQ.1.1 and XBB.1, from which a strain widely circulating in the Northeast descends. I think that information is very concerning because the public, the world, has returned in many aspects to the life as we know it. Oh, here we go. Noting families gathered and people traveled over the holidays as they did in pre-COVID times. Oh, the horror. People were traveling. I traveled. The airports were completely full. The plane was packed. And that might be okay if you're a reasonably healthy person who, if they get COVID and it becomes a little more severe, can call your doctor and get some Paxlovid. Didn't they just say it's now not quite as effective against XBB.1.5? But anyways. But that's not going to be okay for somebody who has heart disease, lung disease, is frail and elderly. For those folks, that infection may result in death. And right there, fear-mongering. Frederick Bushman, who oversees the Bushman Lab, a microbiology research lab at the University of Pennsylvania's Perelman School of Medicine. Man, all these medicine schools and all these types, every single article has somebody else that they're going to. Said that even though the vaccines may be less effective against a particular subvariant, people are still better off immunized. Our countermeasures are getting better and better. Vaccines still work, do they? Vaccines work better if you have the vaccine and get infected. But anyways, go out and get vaccinated and get the infection. Maybe they work a little less well with the new variant, but they still work. Pascal emphasized that regardless of what variant is circulating, people should get back to some basics when it comes to limiting the spread of infectious illness. She urged people to make use of simple measures like hand washing, wearing masks in crowded spaces, and staying home if you feel ill. That's the last part is something that people have been saying for decades. If you're not feeling well, stay home. But anyways, so did we actually learn anything about it? I mean, that pretty much told it all right there, and then they went ahead and wrote another rest of an article for I don't know. Let me know what you think. Did it actually tell us anything other than it's more infectious and probably not as deadly type thing, aside from which they don't want to tell you. But aside from that, let me know what you thought. Like, subscribe, leave a comment. Come on over to Rumble, and I'll see you next video.